We have some vesicles and some bullae on an erythematous base. What do we have here, guys? Wrong. What about here? Linear erythematous plaques with some vesicles there. What do you think we have? Wrong. What about here? Yeah, this is a good one. I think you guys are figuring it out. That's right. Poison ivy, allergic contact dermatitis. So contact dermatitis is an inflammatory reaction of the skin to a chemical, maybe a physical or biological agent. So this induces a reaction to a skin irritant. And this could be either clothing, jewelry, soaps, cosmetic items such as hair dye, and plants. In this case, this is a plant. Poison ivy, 50% of the population in the United States will develop some type of reaction to contact with poison ivy, or poison oak, or sumac. That's why they say, leaves of three, let them be. I like that. Leaves of three, let them be. So in this case, we have the classic sign of poison ivy, which is a linear erythematous plaques with some vesicles and some bullae. And it's a linear because the patient brushes against the plant, and so the rash goes in the direction that the patient brushed against the plant. This reaction doesn't happen immediately. It usually happens 2 to 21 days after brushing against the plant. So usually you get people who come in like 3 days to a week later, and they have this intense itchy rash. Their main complaint is itching. It's just unbearable. They cannot sleep. They've tried everything over the counter. Nothing is working for them. The main thing you want to ask these patients initially is, have they washed the area? They need to wash the area that's exposed thoroughly with soap and water. That gets rid of the oil that's on the skin. The oil is what spreads and is also can spread to other people as well. So once they can get rid of the oil on the skin, that's the road to recovery. We can start treating the itching and the inflammation. So thorough washing with just some regular soap and water, and also wash their clothes at home too. Treatment in severe cases like this: high potency corticosteroids, topical. I would give a dose of Decadron in the office or in the clinic, urgent care, wherever you are. And you can also consider sending them home on prednisolone, 0.5 milligrams per kilogram. A mid-or dose pack will not do the trick in this case, since it's short acting, and usually people can have a secondary reaction up to 21 days afterwards. So usually you can give them that, and then they'll have a secondary reaction and come back to the office. So if you are going to do prednisolone, you want to do a 14-day course of prednisone. Usually topical high potency topical corticosteroids I like to use is betamethasone cream. You can do that every 12 hours, I'm sorry. And usually I'll prescribe them maybe even up to 60 grams. That will do the trick. Remember, 30-gram dose will cover the entire body once. So if this is just on the hand, you might be able to get away with the 30-gram dose, but if it's more extensive areas, then you might need to go with a 60-gram dose. Now if it's on the face, you want to go with low potency corticosteroids, such as a hydrocortisone 2.5% cream every 12 hours for 2 weeks. Now the itching is the main problem here that people complain of. So Benadryl, 25-50 milligrams every 6 hours as needed for the itching. You can even do hydroxyzine, 10 to 25 milligram tablets every 6 hours, or cetirizine, 10 milligram tablets every 24 hours. Oh yeah, and pets can carry this antigen on the oil on their coats. So if you do have pets, you do have this, wash your pets thoroughly. Make sure that this doesn't spread to your kiddos or anybody else around the house. Alright, so boy, leave a comment in the comment section. Let's get this discussion popping. Tell me what you think. Have you had any patients sorry, have you had any patients? I'm sure you've had patients with poison ivy. What's your go-to? Do you do Decadron? Do you do Solumedrol? Do you send them home with triamcinolone ointment? Tell me what works for you guys. Let's get this discussion popping. Again, I'd love to hear back from you guys. It just helps this community grow, helps us learn a little bit, and